Hi, I'm Audra Burns from Dartmouth-Hitchcock, and I'm joined today by Dr. Chatoorgoon, Pediatric Trauma Medical Director at the Children's Hospital at Dartmouth-Hitchcock. We're here today to talk about a very important topic of winter sports safety. But first, Doctor, tell me about your specialty and the work that you do here at Dartmouth-Hitchcock.
Hello, and thanks for inviting me. I am one of 3 pediatric surgeons here at CHAD, and we take care of both pediatric trauma and the rest of pediatric surgery. And it's pretty broad. We cover everything from premature babies up until adolescents. And that might include congenital anomalies that your child was born with, or acquired anomalies like chest wall deformities or tumors. And of course, we manage emergencies like appendicitis.
Well, we're fortunate to have you on our team here at CHAD. So let's talk about, New Englanders, we don't like being cooped up, and we would love to be outside as much as we can in the winter. We have so much fun activities of sledding and skating and skiing, but there's often injuries that can be pretty detrimental to people. So talk to me about what type of injuries you're seeing with common sports activities.
Well, I think the most common injuries we're seeing are falls, whether from snowboarding or skiing, but we do see injuries from sledding and hockey injuries, of course.
And what are ways that parents can prevent these injuries from happening?
There are many ways that parents can help prevent it. The number one is encouraging helmet use, having a culture of helmets for skiing and snowboarding, just like they have in the Olympics, actually. And to encourage their child to know their skill level and to stay within it. So, they're not going to be skiing the black diamonds right off the bat, but slowly they can work up to it in a controlled way. I think the other thing is to know where they're going. It can be really important to know, where are they sledding? Are they sledding just on the hill down the road, or are they in the forest going down the mountain with trees and rocks all over the place? So knowing that is very important.
Absolutely. Knowing your surroundings, no matter what season it is very important.
Yeah.
So does the type of equipment our children wear make a difference in injury prevention?
Oh, absolutely. The equipment's so important. In particular, helmets. Helmets have really changed the types of injuries we're seeing. The number of head injuries have gone significantly lower from that. So if there's one thing I hope they take away, is to encourage helmet use, especially for skiing and snowboarding. For hockey, there's of course mouth guards and equipment pads that are really helpful. And then the other thing is things like goggles. We don't think of it as a safety equipment, but it helps to keep our vision clear so that we could see in the cold weather and when you're going really fast down the hill.
So we hear a lot about, the importance of staying hydrated during summer activities. Is this something that we should be promoting during winter activities?
Absolutely. Hydration is very important, especially if you're out there for a long period of time. It may feel like you're not getting as dehydrated because it's cold out, but the truth is, with the clothing you're wearing and the intense activity, you could be sweating quite a bit. So staying hydrated is important throughout.
Now, I'm a mom of 2 boys, and I've heard this line before from them where they've come in and they've said, I was out with my friends and I just hit my head, but I'm feeling fine. I think that's probably a common thing that might happen with parents. So Is there something that we should be looking out for if our children tell us that they've bumped their head? Could there be a problem that we should be looking for, and what should we do?
A head injury is always a scary thing. And when your kid comes in from, say sledding down the hill and reports a head injury, the first thing to ask is, did they black out? Do they remember the whole event? Or were they out, or did their friends point out that, oh, you weren't responding for a few seconds? That's kind of a crucial thing. If they remember the whole thing, then that's very reassuring. Sometimes, though, when things happen very quickly, they don't necessarily remember everything, and they're not sure if they really blacked out or not. Well, you could just keep an eye on them. Number one is, are they behaving normally? Are they speaking normally? Are they complaining of headaches? Are they vomiting? If they're able to drink and eat and they're not really having too many aches or pains, that's very reassuring. The bottom line is, though, if you're not sure and you're worried, or any of these symptoms are occurring, definitely get checked out at your nearest ER. We might do a full workup from a neurologic standpoint and possibly a CAT scan.
Well, we have a lot of cold weather coming up, so thank you so much for these important safety tips.
Thank you very much.
For more information on other health and safety tips, please visit chadkids.org.